And as far as, the one new food every 3, 4, 5 days, I've talked to the leading, food allergy dietitians in the world, and they all tell me the exact same thing. You ready for this? It's completely made up.
I know. Yes.
It's made up. It's a highly conservative approach,
Yeah.
where we used to tell families, well, if something's going to occur, if you do one new food every 4 or 5 days, then we'll know exactly which food caused it. But now I look at it the flip side. So if we say that food allergies affect 5 to 8% of all children, that means 92% of children will never develop a food allergy no matter how you feed them. So if we're telling 100% of families to be extra cautious, that's a huge disservice to the vast majority of families. So I like to say, feed as many foods as you want. If something worrisome happens, we can figure it out.
Then people are overthinking the whole feeding process, right? And I think our generation especially has gotten so stressed about, okay, well, puree, baby-led weaning, and then you add what to make, and then you're saying, well, you can't give this, you can't give this, you gotta wait 3 days. I personally, who has that mental load to be able to think what did I give on Monday? I don't even know what day it is, regardless if I'm feeding my kid, let alone what I ate 2 days ago.
We want to actively introduce allergenic foods, and here's the important part, and keep it in the diet consistently. So if we give a little nibble of, say, peanut butter and then wait another 3 to 4 months, that's where we may actually promote allergy development. Whereas if we keep it in the diet several times a week, or ideally every day, that's how we promote tolerance and we prevent allergy from developing.
Welcome back to the Peds Doc Talk podcast, a top parenting podcast in the United States to guide you on your parenting journey. I'm Dr. Mona, and I get to chat with the most incredible people in the field of child health and safety, development, and parenting. And this show is a top podcast because of you, so keep leaving those reviews. I say it every week, but in the podcasting world, it's all about word of mouth and rating or reviews. So after you listen, or maybe pause it right now, make sure to leave that review or rating. So as a pediatrician, I get tons of questions about food allergies, and so much has changed. So I needed to get an expert in allergies to chat about this today. Today's guest is Dr. Dave Stukus. He is a professor of clinical pediatrics and a true academic allergist who has spent the past decade combating misinformation on social media. He's on Instagram as Allergy Kids Doc, one of my favorite follows, a colleague of mine in the social media world. Thank you so much for joining me today.
It is my pleasure. Thanks for having me. I'm excited to be here. This is going to be great.
Well, I joined social media in 2019. I found you early on in my journey, and I cannot believe it took, 4 years for you to finally come on the show. Thank you, because obviously you are a wealth of information. I know you are so busy with all the clinical work that you do, the research that you do, and also getting that little pockets of time to combat the misinformation online. But before we get into this conversation, tell everyone more about yourself and the why behind your love for pediatric allergy.
Yeah, so you nailed it. I am an academic pediatric allergist. I'm a professor of pediatrics, and I work at Nationwide Children's Hospital in Columbus, Ohio. And I do everything that an academic allergist will do. So I see patients at our food allergy treatment center, where I'm also the director of our center. And I do research, and I participate in quality improvement. I do a lot of work with our professional organizations, lots of work with advocacy. And then every once in a while, when I find some spare time, I post some stuff on Instagram as well. But the reason I got into pediatric, allergy is because, unfortunately, it affects millions of children. If you think about the most common chronic health conditions, we're talking about asthma and allergic rhinitis and eczema and food allergy. And I love being able to offer, not only kind of clarify the diagnosis, which I think we're going to talk about today, but offer, individualized solutions for each single family and each single child. We can really make their lives better. And, these children are impacted by these conditions on a regular basis. It interferes with their sleep, quality of life, missed school, and we can provide help. And it makes me feel pretty good about that.
Yeah. And again, the work that you're doing is so incredible online, and also obviously in real life education and clinical practice that you do. And we are going to be talking about allergy myth busting. So that was kind of the purpose of this episode, is to kind of talk about food allergies and some myths that we hear, old recommendations versus new recommendations. So one of the first things that I think parents have is they are being told still by some doctors out there to wait to introduce allergenic foods, or also to wait 3 to 5 days between introducing new foods. I'm curious about, the current recommendations and where it stands on needing to wait 3 to 5 days between introducing new foods, allergenic foods. Is this needed? Is there some nuance to this? Tell us more about that.
Yeah, I think we need to acknowledge the elephant in the room. Collectively, as medical professionals, myself included, we've done a really good job at just scaring the hell out of parents
Yes,
over the
we
last 20 years at feeding your babies. My
have.
goodness, we did such
Yeah,
damage.
I
But
know.
the evidence changes over time. The evidence is very reassuring, and if we follow what the actual evidence shows, we want to encourage, introducing solids to babies when they're ready, usually around 4 to 6 months of age, and this includes all of the allergenic foods, so milk, egg, wheat, even peanut butter, age appropriate tree nut products, because that's the best way that we can actually promote tolerance and prevent allergies from developing. We don't need parents to drive to the parking lot of their local emergency
Yes.
room the first time they feed peanut butter. And as far as the one new food every 3, 4, 5 days, I've talked to the leading food allergy dietitians in the world, and they all tell me the exact same thing. You ready for this? Is completely made up.
I know. Yes, yes.
It's made up. It's a highly conservative approach,
Yeah.
where we used to tell families, well, if something's going to occur, if you do one new food every 4 or 5 days, then we'll know exactly which food caused it. But now I look at it the flip side. So if we say that food allergies affect 5 to 8% of all children, that means 92% of children will never develop a food allergy no matter how you feed them. So
Hmm.
if we're telling 100% of families to be extra cautious, that's a huge disservice to the vast majority of families. So I like to say, feed as many foods as you want. If something worrisome happens, we can figure it out.
Right. And also, I think what happens there, and I think that recommendation is outdated in that then people are overthinking the whole feeding process, right? And I think our generation, especially, has gotten so stressed about, okay, well, puree, baby led weaning, and then you add what to make. And then you're saying, well, you can't give this, you can't give this, you got to wait 3 days. I personally, I mean, who has that mental load to be able to think, what did I give on Monday? I don't even know what day it is, regardless if I'm feeding my kid, let alone what I ate 2 days ago, right? I mean, it is so much more stress. And I think by saying that, not only is it not evidence based, we're taking away the joy that I think exists when we introduce solid foods.
I couldn't agree more. Feeding our
Yeah.
babies, it's not a medical procedure.
Right. Right. Right.
Right? It's like we need to feed our babies. It should be
Yeah.
fun. It should be exciting. Let them explore, different tastes and textures and expand their diet. I agree.
Yeah. And I love that because, yes, I think I still hear it to this day. And on my social, I'm sure you hear it and you're hearing maybe that outdated information. And it kills me when my colleagues at my own practice are still saying this rule. And I'm like, guys, let's get up to date here. What is the reason? And again, you brought it up beautifully. Well, how will we know? I'm like, well, they'll tell us that they ate yogurt, a toast, and peanut butter, and then we'll figure that out. It's okay. Like you said, it's a rare situation, and I rather have it that we don't have this stress, and also this can just delay the exploration of yummy, delicious
Mhm.
food if we're doing 5 days. I had a parent say that someone told them to wait a week in between foods, and I'm like,
Oh
a
boy.
week? If you wait a week, your child's only going to get introduced a certain number of foods in their first few months. That's not enough. I need them to explore, and this includes allergenic foods as well, right? Meaning allergenic, non-allergenic foods. You don't need to have this sort of 3 to 5 day rule with all foods, correct?
That is absolutely correct.
Yeah.
Yes, in fact, we want to actively introduce allergenic foods, and here's the important part: and keep it in the diet consistently. So,
Yeah.
if we give a little nibble of, say, peanut butter, and then wait another 3 to 4 months, that's where we may actually promote allergy development. Whereas if we keep it in the diet several times a week, or ideally every day, that's how we promote tolerance and we prevent
Yeah.
allergy from developing.
Now, why are some babies more at risk of severe reactions compared to older children, in terms of allergies? Do we see that, or is it more that you can have a bigger reaction as an older child? What is it about the reactions?
Yeah, so interestingly, babies are less at risk to have severe allergic reactions or
Hmm.
anaphylaxis. And
Yeah.
there's new anaphylaxis practice parameters, which are our guidelines that actually go through, and they have a consensus-based statement and recommendation that basically says for babies, it's pretty rare for their first
Yeah.
reaction to be, severe or require epinephrine or emergency care or things like that. More often than not, they'll get some hives or maybe they'll vomit and they feel better. Now, can they have more severe reactions? Absolutely, it can occur. And when it does, it's pretty scary for parents. And unfortunately, those are typically the stories that get shared on social media that just scare all parents. But the typical story is, I see this every day. That's all I see are food allergy concerns at our food allergy center. Every single family comes in with a similar story of, we fed this, we noticed a rash, we noticed hives, or they threw up, so we stopped feeding it. We're seeking evaluation now. So that's the most common presentation of food allergy in babies.
Yeah, I'm happy to provide that reassurance because I think, like you said, when we introduce solids, the fears that I hear commonly from parents are the mess, what to feed, this whole delaying, the 3 to 5 day rule, all of that, choking, gagging, which we're not talking about. But then
Yeah.
another big thing is the allergenic reaction. Well, what if they have it and I don't know what to do and I cannot get to a doctor in time? And you had alluded to the fact that some parents are so scared of this reaction that they'll sit in the parking lot and outside of a hospital and introduce peanuts. And what would you say to that parent who's like, listen, I just want to sit outside and it's the first time we're ever introducing peanuts? Because we also know that you're not going to get a reaction often the first time you have an exposure to this food, correct? Not always.
Right. Yeah. So people can develop food allergies on, after eating it several times, or maybe it's the second
Yeah.
or third time you feed it. So in all honesty, what I like to do, and there's a reason we have two psychologists on our staff at the food allergy
Yeah.
center, is because there's such anxiety surrounding this diagnosis and feeding babies. I like to have a conversation with families of like, why are you so worried about this? Where does this come from? What is influencing you in your life? Is it an older child that has food allergies? Well, let's have the conversation about this younger child and how we can approach this. I have the benefit I can offer to actually introduce foods in our office. We do about 1,000 oral food challenges a year. So if there is ever any concern, come hang out with us and we'll have fun. We'll have a
Yeah.
nice little feeding party in the office and give you reassurance. But it comes down to that root cause of like what's going on here and why are you so concerned in the first place?
And you mentioned for babies, sometimes they may have vomiting or hives. When
Mhm.
it comes to a true, concern for an allergic reaction, when are antihistamines useful? And also, why has Benadryl fallen out of favor as an antihistamine?
Yeah, it all comes down to what are the symptoms. So if the
Yes.
symptoms are itching and hives, then antihistamines are great because histamine is the chemical that gets released from those allergy cells in the skin that causes the itching and the hives. We've fallen out of favor for Benadryl, otherwise known as diphenhydramine, because just because it's been around for 80 or 90 years doesn't mean it's the best option. We have such better options available. So we have these non-sedating, long-lasting second-generation antihistamines. The brand names are things like Zyrtec and Allegra and Claritin. Not only do they work faster than Benadryl, but they last 4 times as long, and they don't have the terrible side effects that Benadryl has.
Yeah.
We've been giving Benadryl to babies like it's candy for years, but I don't know if it would be approved by the FDA if it went before today because of the terrible side effect profile. So we really have altered our approach to using antihistamines. But then, of course, if there are more severe allergic reactions, so anything more than hives, so if you start to have repetitive vomiting, if you start to have coughing, difficulty breathing for any reason, that's when epinephrine is going to be the treatment of choice. And that's the first line medication to treat anaphylaxis, which is a severe allergic reaction involving more than one part of the body. So for those who don't have a diagnosis of food allergy, you're not going to have epinephrine at home, nor do you need it at home.
Right.
But certainly those that have that diagnosis, if they have future episodes, then that's how we educate them to how to use epinephrine and when to use it.
Well, you'd already mentioned about the fact that, babies are less likely to have a severe reaction compared to an older child with a food allergy. And I think that's hopefully reassuring to our listeners because I think the fear that I hear a lot of parents have is that, like I said, they're going to eat something, they're going to have a severe reaction, and that's going to be what happens mostly when we know that that's not usually the case.
Mm-hmm.
And so if they end up having a reaction, let's say, again, going back to the hives or vomiting, obviously calling the pediatrician, letting them know what happened. Typically, I know a lot of my patients get advised on the nursing line to give an antihistamine and follow up the next day. Is that usually what you recommend as well if there's that first concern of an allergic reaction that's mild?
Yeah,
Like a,
absolutely.
yeah,
Yeah, absolutely. Sorry. Yeah. So if you have concerns, it really helps to know what did your child eat within that
yeah,
1 to 3 hour window before symptom onset. We don't need to take a history of what did they eat over the last 3 or 4 days because food allergy reactions happen within minutes, rarely longer than 1 or 2 hours later, with some rare exceptions. So let's focus on that food or snack they had right before the symptom onset. I often hear from families, well, how do I know if my child's having an allergic reaction? Let me say, for 16 years of experience as a pediatric allergist, you're not going to miss it. Trust me on
yeah,
this one. You're
yeah.
going to recognize your baby's going to have an acute change. And in babies who can't verbalize what's going on, oftentimes you'll see a change in their behavior. They're going to be pretty fussy or irritable because they're probably itchy or maybe a little nauseated. So they're not going to look well, which is very different than those infants that get these contact non-allergic rashes from like strawberries and tomatoes and sauces where they get some redness on their face, but they look happy as can be. That's very different than an acute allergic reaction. So if you have those concerns, definitely call your pediatrician and be prepared to talk about the foods that they ate just prior to symptom onset.
Well, thank you for bringing up that differentiation because, like you just brought up, sometimes just from the contact, of a food around like the baby's mouth. It could be just like a little irritation that fades, the baby's happy. That is a really important distinction. Would a food allergy sort of hive rash that you're mentioning, would that be more of a full body? Would that be isolated if someone is like unsure of what that might look like?
Yeah, it can vary. And I educate our residents and fellows that rotate with me of when we diagnose food allergy. It's kind of like Mad Libs. Do you remember Mad Libs?
Yeah,
So you
yeah,
have to like fill in the blank. So we need to hear
yeah,
from the families of like, okay, what was the food of concern? What was the
yeah.
period of time before symptoms occurred? What were the symptoms and where do they occur? How long do they last for? So if you come to me and you say, I'm really worried that my child has an allergy to carrot because when they eat carrots, 4 days later, they get itching on their foot. I believe you and I hear you, but I'm not worried about
Mhm.
food allergy because it's not a
Right.
very common cause of allergy. If you say, I gave them peanut butter, within 15 minutes, they had hives head to toe. Now you have my attention. That's more likely to be food allergy. So it always goes back to what the history is. Hives can be localized, they can be more generalized, there can be combinations of symptoms, but it really comes down to what was the food that they ate and how soon after before you notice those symptoms.
I love that. What a great approach. I mean, again, going back to what we had talked about taking out the stress of like that 2 to 3 day window, like we can
Mm.
just have a conversation, ask the family. People can remember, yeah, we had this, that, or the other, and then we kind of dive in and go from there. This episode, we're not talking a lot about obviously the testing and
Mhm.
like all that. We'll probably save that for a future episode. But of course, then there is a different workup that may be done once that child has a concern. On social media, we see a lot of accounts talking about foods causing eczema and also
Mm.
about elimination diets. So there's a lot of back and forth I'm seeing. I see a lot of the allergy world obviously saying one thing, and then I see a lot of parents saying, no, I took this out of my diet and you need to do the same thing. What do we know at this point about eczema and food allergies? Is there an actual causation? When people talk about triggers for their eczema, do we actually see that? What is it that we know with food and eczema at this point?
Yeah, this is where it's really important to understand anecdotes are not evidence. And if we look at the evidence, including the current, eczema treatment guidelines, there's a very strong statement that, food avoidance is rarely, if ever, indicated. And the reason why is because eczema is a very complex chronic skin condition. That's a
Yeah.
combination of a skin barrier defect where water escapes from the skin, so it gets very dry, but it also allows irritants and allergens to enter. And there's a very complex immunology underneath the skin that's occurring as well. Eczema is not caused by one specific food in the diet. It's way more complex than that. Now, as far as people thinking that foods are triggering eczema or contributing to it, a lot of times this is more correlation. And this is
Yeah.
where we talk to a lot of families about, well, one, avoidance of food in the diet can actually be very harmful. So we know that children with eczema are at higher risk to develop food allergies if they're eating a food and they're sensitized to it, meaning they have elevated IgE on testing, but they're not having reactions. And then you take that food out of their diet. That's how we create food allergy. So it's well established, like medical professionals are causing harm by telling people to take food out of their diet that's not causing acute allergic reactions, especially if they're sensitized. We have to recognize that. I'm in defense of breastfeeding mothers everywhere who are given these outdated blanket recommendations to just stop eating milk and egg and peanut and wheat. It is extremely unlikely that any of that food allergen is passing through the breast milk to contribute to eczema. How do we know this? Because infants who have actual food allergies, including anaphylaxis, their mothers don't need to stop eating the food. They're not
Right.
passing the allergen through the breast milk. They're passing, nutrients through the breast milk. And then we just have so many great, effective, topical therapies to treat eczema that we don't need to go to, food avoidance. Are there some infants out there that have truly severe refractory eczema that will benefit from avoiding certain foods in their diet or mom's diet? Yes, but that is the exception and not the rule. We hear all these emotional stories on social media, but we have
Yes.
no way of verifying whether any of that is true or accurate. Plus, also all the biases that go into play. I have a lot of families that say, well, I stopped eating milk and egg and their eczema got better. And then you ask the follow-up questions and they say, well, we also switched the type of soap we were using. We
Yes.
started using a greasy moisturizer. We
Yeah.
found an effective topical steroid, and all this other stuff goes into play. So it's a complicated matter. It's rarely, if ever, just it's a single food causing it.
Well,
Hopefully
listen,
I drove the point
yeah,
home.
absolutely. And you said it perfectly that I not only in the allergy world, but in all things parenting and child health, I get tagged in all these videos of these stories of parents
Mhm.
sharing this. And I also want to believe all those stories and say, yeah, okay, I'm going to use vaccines as an example, right? A
Mm.
parent will say that, oh, my child got a vaccine and so, such and such happened. Maybe they're on this sort of anti-vaccine platform. And I'm like,
Hmm.
listen, I want to believe you, but we also know, and I'm going to be quite frank, and you know this too, that a lot of times people share stories to sell something that may not
Hmm.
be actually in evidence, right? So for example, this example, I cured my child eczema by taking this, doing this elimination diet. Comment elimination diet, and I'll send you my 10-step elimination diet for, $20. And so
Hmm.
then it's like, you got to remember that, is there a conflict of interest? Because me and you are not charging people money to give them the evidence, right? So if someone, I always say that when there's misinformation, I'm like, if someone is giving you health guidance through a paywall, there's something very fishy to me, because
Hmm.
health guidance should always be accessible, whether it's through, you going to conferences, the literature out there. My YouTube channel is free because I know that if it's there, I'm going to give you all the evidence. And so always remember that when you're watching those stories and you're like, wow. And take it to your pediatrician. I mean, if you're saying like this person cured their eczema, talk to your pediatrician. I hope that they also understand the most current evidence. Listen to this episode as well. Follow, Dr. Stukus here, because I really want us to do true diligence for our children and not do unnecessary testing and unnecessary elimination diets, like you said, because that can cause more harm than good by avoiding certain foods that may be useful for their diet and can avoid an allergy, like you mentioned.
Well said. I couldn't agree more. And frankly, if anybody listening right now or watching, if this conversation it sort of triggers something where you're like, how can that be? All these
Yeah,
other people in my life are saying otherwise. It's not. Don't take my word for it. Go read for yourself.
yeah,
You can search atopic dermatitis practice parameters. It gives you all of the evidence-based information, and there's a great summary and explanation for all of this. So this isn't my opinion that I'm sharing here. I'm just merely relaying what the evidence to date shows. So yeah, I agree with you. If somebody is selling you something in exchange for information, that's a huge conflict of interest. The other
yeah,
thing is, I talk about that. I have this conversation all day, every day. Correlation does not equal causation. So yes, I completely hear you that ingestion of a certain food correlates with worsening eczema. But let's talk about all the dozen other
yeah.
factors that can also worsen eczema, such as viral infections, weather changes, not using enough moisturizer on the skin, fragrant skincare products, all of that stuff.
Exactly. And you mentioned that, right? Like the detergents, maybe they changed something around the time that this happened. So that is such a key thing. And I think as academics, I think we talk about that correlation, causation all the time. And I love that you're bringing that up, because it is important to remember that so much of things can be correlated in a personal situation, but that doesn't mean that there's evidence, and also that that applies to every situation, because we don't know the details all the time. I really appreciate that. But we talked about obviously how, foods causing eczema, but we do know that children who may have moderate to severe eczema may be more at higher risk for food allergies, correct?
Yes, yeah.
So
So
let's talk about that, because I know that can be confusing, because we just said, well, food doesn't cause eczema, but that
right.
eczema babies can be higher risk. And why is that? Yeah.
Yeah, so thank you for bringing that up. So there's no single cause for why some people develop allergies, but to the best of our knowledge, there's a complex interaction between one's genetics, what we get from mom and dad in our DNA, and early life exposures. So eczema is often the first outward sign of that baby raising their hand saying, "Pay attention to me.
Hmm.
I'm the one who's likely going to go on to develop food allergy, asthma." Environmental allergies. So eczema often improves within the first couple of years of life, but then things kind of shift and they start to develop allergies to things in the environment and asthma and things like that. Eczema doesn't cause food allergy, eczema doesn't cause asthma, but eczema in early life is associated with later development of these conditions. And as we mentioned before, we now know that, early introduction of allergenic foods and ongoing inclusion in the diet is the best way to prevent food allergies. So if you have an infant with especially moderate to severe persistent eczema, they are the ones we absolutely want to get them to start
Yeah.
eating allergenic foods early and keep it in their diet. We can change their life. Is it 100% effective? No, absolutely not. But it's one of those things, Dr. Mona. We'll never know. Like when we prevent food allergy, right? We'll never know. It's hard because we
Yeah.
don't know what that timeline is going to be. But this is the best advice that we can offer people: not food avoidance, but food inclusion.
Well, you had mentioned that, starting solids 4 to 6 months. I remember when I joined social media, there was a lot of larger accounts than mine that were saying, you cannot introduce solids before 6 months. Like pediatricians don't know what they're talking about. And you just
Hmm.
brought up a great example of a situation where if a child is showing signs of readiness after 4 months, for purees, for example, that perhaps the early introduction of allergenic foods between 4 to 6 months can be beneficial.
Oh, absolutely. Yeah. So
Yeah.
everybody's a little bit different. Some babies aren't ready till they're 9 months old, and that's
Right.
okay. It's not like
Right.
there's a critical window on 6 months and one day that we miss this window where we can prevent
Yeah.
food allergies. But some babies are ready sooner. And it's interesting. So as this has been studied over the last, oh my gosh, we're coming up on a decade now from the pivotal LEAP trial
I love
that
it. Yeah.
showed early introduction of peanut and inclusion prevents peanut allergy. So here we are 10 years later, still having this battle. But I get it. There's a lot of confusion because we used to say avoid, 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 and now we're saying feed. But it's all based on the evidence. So there was no evidence before that supported avoidance. It was sort of a best guess. Now we have
Yeah.
really good evidence that supports early introduction. So I think that's what we need to promote.
Yeah, it came out, that LEAP study came out when I was actually in training. And so my whole training has been early introduction. But of course, I was with colleagues and people who were trained before me that were like, wait, what? A year
Yeah.
you have to wait. And so yes, do not wait until a year. If you take home anything from this message, do not wait until a year, unless of course you're being guided by an allergist or something for whatever reason. But yes, there is
Mm-hmm.
no reason you have to wait. My last question, I guess, is food allergies seem to be on the rise. I mean, I look back at my childhood and I know children who had, my peers who had some allergies, but they definitely seem to be on the rise, I feel. Do we know why? And can we maybe squash the vaccines causing food allergy debate? What do we know about this? Is it really on the rise? Any idea? And maybe obviously we may need more research, but I'm curious where we stand at this point.
Yeah, thanks. So yes, we have seen almost a tripling in the prevalence of food allergies over the
Mm-hmm.
last couple of decades. So we are seeing an increased number of children with food allergies as well as allergic conditions in general and asthma. So that is without a doubt happening. Anybody who says that they figured out the single reason why has no idea what they're talking about. We've already talked about it. This is a very complex issue
Yeah.
here. There's no single predetermination. There's no single exposure. There's a lot of things that are correlated with it. The hygiene hypothesis has been around for decades, and that's shown that basically as humans have moved towards more urban environments and moved away from farms and specifically farm animals, and more specifically farm animals that are eating poop and then licking babies,
Yeah.
we we know that cleaner environments are associated with higher risk of developing allergies. And if you think about the allergy antibody called immunoglobulin E or IgE, there's no evolutionary advantage for why somebody should have IgE towards peanut, right? This doesn't provide us any protection as a species. IgE was initially developed to protect us against parasitic infections. So
Mm.
as we move away from these farming environments and rural environments
Yeah.
towards cities and stuff like that, we don't have to worry about parasites anymore. So the way I think about it, which may be incorrect, is IgE kind of got bored and it started directing itself towards things like ragweed and dog dander and peanut, which makes no sense whatsoever. But it does line up with the hygiene hypothesis and why we're seeing increases in allergy in general. As far as the vaccine stuff, it's complete nonsense. There's actually very
Yeah.
good evidence that shows, children who are vaccinated actually have less allergies than those who are unvaccinated, which is interesting. All the anti-vaccine propaganda, this goes back to like the 1960s where they were
Yeah.
studying peanut oil as an adjuvant, which actually never went into commercial vaccines. But if we were injecting kids with, food allergens with their vaccines, we wouldn't be, causing food allergies to develop. We'd be causing allergic reactions, which we're not seeing. So it's just
Yeah.
all nonsense.
Yeah, I love that. Thank you for sharing that perspective. That makes a lot of sense. I actually do believe in the hygiene hypothesis myself, but of course it's so layered. But how you described it with the IgE got bored, it makes sense, right? They're like, well, I don't have parasites to fight because this animal's not licking my baby, so let's just find something else. I love the way you frame that. Thank you so much. This was such a great conversation. I, hope we really busted a lot of myths about food allergies, and I hope our listeners really learned a lot because I think a lot of this misinformation is still out there. What would be your final message for everyone tuning in today?
If anybody told you something in regards to food allergy or allergen or feeding your baby, anytime outside the last 6 months, it's probably outdated.
Mm,
so,
very good.
I mean, this space is changing so
Yeah,
rapidly. Things I'm recommending to families now, I wasn't doing 6 months ago. I certainly wasn't doing a year ago or 2 years ago. So, follow the science. Don't fall for the marketing because the marketing is everywhere.
yeah.
And the evidence absolutely matters when it comes to this stuff. So hopefully that you have a trusted relationship with your own personal pediatrician or allergist, and please go to them if you have any specific medical concerns, and don't rely on folks on social media because oftentimes they don't know what they're talking about.
Yeah, and oftentimes they're not doing what the work you're doing in terms of staying up to date on this ever changing knowledge that we're gaining in this field. It is actually, I'm a general pediatrician. Of course, I rely on my specialists like yourself and all my other specialists when I don't know what's going on or if I need more information. And so I will say that the whole allergy world has always been very fascinating to me, meaning why are we seeing this? What can we do? Is there anything we can do? The early introduction of allergenic foods, all of this stuff is an area of huge interest, which is why I also wanted you on the show for just personal, up-to-date knowledge for myself. We can consider this a CME session for myself. But also, I just think it's really just important for all clinicians to stay up to date on this and for people listening to go to the evidence so that we will always provide you with the evidence. I mean, I think me, you, all of us in this world, in this job, we want to help our kids, and we would love if we could prevent food allergies, seasonal allergies, all of that. But we know right now we do what we're doing and we keep up to date. And that 6-month rule is right on. I might have to have you on again in another year for the latest and greatest updates in allergies because of what you said.
That would be great. And if I may, frankly, I don't want a job. I really don't. I would love if there were no children with allergic conditions or food allergies.
Yeah.
I would be a jungle cruise skipper at Disney World or something like that. But I'm here to help for as long as I can.
Same with me. It's what it is. And you're fighting the good fight every day, like I said, in person with all the academic work that you do, but also on social. So thank you so much for joining us today. Where can people go to stay connected? Share your Instagram handle again and any other resources that you'd want to share.
Yeah, so I'm on Instagram. My handle is at allergykidsdoc. I can never give individual medical advice, so please don't send me pictures of your child's rash in my DMs. I have screenshots of all that terrible stuff. But yeah, I'll hopefully be able to provide perspective and the latest updates whenever new evidence breaks. That's for sure.
Yes, thank you so much. I will be attaching that to our show notes, Allergy Kids Doc, so that you can stay connected with him and his journey and all the research out there. Like I said, for me, whenever there's an update or something in the news regarding a new medicine in the allergy world, I'll immediately go to his page to see what does he have to say about this. I know he's busy, but eventually he'll post something. But thank you. Thank you so much for the work that you do. It really means a lot to me as a general pediatrician and also, I'm sure, all of our listeners today.
Yeah, well, feeling is mutual. Thanks for having me.
And for everyone tuning in, if you love this conversation, which I'm sure you did, please remember to leave a review and a rating, and also share this episode on social media, especially on Instagram stories. Tag Allergy Kids Doc as well as Peds Doc Talk so that we know you love this conversation. And I'm sure I'm going to have him on again for another episode in the future. Thanks for tuning in today.